You ever reach for furniture when you walk? That small habit may be telling you something important. These 5 chair exercises can help improve balance. Safely from a seated position, balance isn't built overnight. It's the result of strong muscles, healthy joints, good coordination, and consistent movement. Even small exercises performed regularly can contribute to better mobility and greater confidence in daily life. That's what today's routine is designed to support. Let's begin with the first chair exercise. Point 1. Seated marching. Sit near the front of a sturdy chair. With your back straight and both feet flat on the floor, slowly lift one knee toward your chest as high as feels comfortable, then lower it back down with control. Repeat with the opposite leg. This simple movement strengthens the hip flexors, thighs, and core muscles that help you walk with better control. It also improves coordination by encouraging each leg to move independently, much like walking. Aim for 10 to 15 repetitions on each side while maintaining steady breathing. If you begin to tire, slow your pace rather than rushing through the exercise. Point 2. Heel and toe raises. Keep both feet on the floor while sitting upright. Lift your toes as high as you comfortably can while keeping your heels planted. Then lower your toes and lift your heels while keeping your toes on the floor. Although the movement looks small, it strengthens the muscles around your ankles and lower legs, which play a key role in maintaining balance. Stronger ankles can make it easier to recover from small slips or uneven surfaces while walking. Perform 10 to 15 slow repetitions without bouncing your feet. Point 3. Knee extensions. Sit tall with your knees bent at about 90 degrees. Slowly straighten one leg until it is nearly parallel with the floor. Hold for 2 or 3 seconds. Before lowering it, gently repeat on the other side. This exercise targets the quadriceps, one of the most important muscle groups for standing up from a chair, climbing stairs, and controlling your body when sitting down. Focus on smooth, controlled movements instead of lifting the leg quickly. Point 4. Seated side leg lifts. Remain seated with good posture. Slowly move one leg out to the side without leaning your upper body. Pause briefly. Then return your foot to the starting position before switching legs. The muscles on the outside of your hips help stabilize your pelvis every time you stand on one leg during walking. Strengthening these muscles may improve stability and reduce side-to-side swaying. Complete 10 repetitions on each leg while keeping your shoulders relaxed. Point 5. Sit to stand practice. Position your feet about shoulder width apart. Lean your body slightly forward. Press through your feet and slowly stand up. Pause for a moment before lowering yourself back into the chair with control. If needed, lightly use the chair's armrest for support. This movement closely mimics one of the most common daily activities. It strengthens the hips, thighs, and core while improving coordination between your muscles and nervous system. If standing completely feels difficult, begin with partial stands and gradually increase the height as your strength improves. Point 6. Shoulder blade squeezes. Sit upright with your arms resting comfortably by your sides. Gently pull your shoulder blades together as though trying to hold a small object between them. Hold for 3 seconds, then relax. Many people overlook posture when thinking about balance, but good posture helps keep your center of gravity aligned. Strengthening the muscles between your shoulders may help you stand taller and move more confidently during everyday activities. Point 7. Seated heel slides. Start with both feet flat on the floor. Slowly slide one heel forward until your leg is almost straight, then slide it back to the starting position. Repeat with the opposite leg. Heel slides improve knee mobility while gently activating the muscles used during walking. The controlled motion also encourages smoother joint movement without placing excessive stress on the knees. Point 8. Gentle trunk rotation. Cross your arms comfortably over your chest or rest your hands on your shoulders. Slowly rotate your upper body to one side, then return to the center before rotating to the opposite side. Turning safely is an important part of everyday life. Whether you're reaching for something, changing direction while walking, or getting out of a car, your trunk needs to move smoothly. This exercise helps maintain flexibility while encouraging better control during rotational movements. Point 9. Seated arm reaches. Sit tall with your shoulders relaxed. Reach one arm forward as though placing an object on a shelf, then return it to your side. Alternate between both arms. Adding upper body movement while remaining seated gently challenges your balance, because your body must stay stable as your weight shifts. This helps train the core muscles that support posture during daily activities. Point 10. Control deep breathing. Finish your exercise session by sitting comfortably with your shoulders relaxed. Slowly inhale through your nose, allowing your chest and abdomen to expand naturally. Exhale gently through your mouth. Deep breathing helps reduce unnecessary muscle tension and encourages better posture throughout your workout. It also gives your heart rate a chance to return toward its resting level. Before you continue with your day, point 11. Move slowly. Slow, controlled movements are generally more effective than rushing through each exercise. Focus on quality instead of speed. Point 12. Stay consistent, even 10 to 15 minutes of exercise most days of the week can be more beneficial than doing a long workout only once in a while. Point 13. Listen to your body. If you experience sharp pain, chest pain, severe shortness of breath, or dizziness, stop exercising and seek medical advice before continuing. Point 14. Progress takes time. Many older adults stop exercising because they expect immediate results. After only a few days, they may think the exercises aren't working because they don't suddenly feel stronger or steadier. But that's not how the body adapts. Balance improves through gradual changes in muscle strength, joint control, coordination, and confidence as you continue practicing these chair exercises several times each week. Your body has an opportunity to build stronger muscles and improve communication between your brain and your muscles. You may first notice that standing up feels a little easier, walking feels smoother, or you no longer need to reach for furniture as often. These improvements are often subtle at first, but they can become meaningful over time. Remember that progress is different for everyone. Some people notice changes within a few weeks, while others need more time depending on their health, activity level, and medical conditions. The important thing is to keep moving safely and consistently, rather than comparing yourself with someone else. Point 15. Protecting your independence starts today. One of the greatest benefits of regular chair exercises isn't simply having stronger legs, it's preserving the ability to continue living independently and confidently. Everyday activities like getting out of bed, preparing meals, shopping for groceries, climbing a few steps, or enjoying time with family all depend on strength, coordination, and balance. These exercises are not a cure for balance problems, nor are they a replacement for medical treatment or physical therapy when those are needed instead. They are a safe starting point that many older adults can include as part of a healthy lifestyle. Combined with proper nutrition, good hydration, quality sleep, regular medical checkups, and guidance from your healthcare provider, they can support healthy aging and reduce the risk of falls over time. The most important step is simply getting started. You don't have to exercise perfectly. You don't have to do everything at once. Small, consistent efforts repeated day after day can add up to meaningful improvements in strength, stability, and confidence. Your future mobility depends on the habits you build today, and every safe movement you make is an investment in staying active and independent for years to come.